Hello, Namaskar. I'm Dr. Suchitra Pandit. I'm the immediate past president of the Federation of Obstetric and Gynecological Societies of India, which we call as FOXY. I'm here today at the 58th AICOG Chennai, where I handed over my presidentship to my successor, Dr. Prakash Trivedi. Friends, my theme for my year was Empower Women, Empower India, Pledge for Excellence. And here we had a vision of reducing the maternal mortality, and the two main causes are the bleeding during pregnancy, which we call as postpartum hemorrhage, and the second is hypertensive disorders, that is the rise of blood pressure in pregnancy, which is the second major killer. We decided to focus on these two activities, and I would like to appeal to all my young friends, the young girls who are going to be the mothers of tomorrow. If you decide to have a baby, always make sure that you go in for a preconceptual clinic with your husband, discuss and do all the investigations advised. Make sure that if there are any problems there, they are sorted out before you get pregnant. The doctor will ask you to take folic acid, which is very good for reducing the spine problems in the baby. My young girls, again I would advise, you must have a very good hemoglobin before you embark upon pregnancy, because anemia is very common in our country, probably because of wrong eating habits, probably because of indigestion problems, and we do not regularly take iron. So therefore, do as your doctor tells you. Once you get pregnant, try to contact your doctor as soon as possible, because you need to register for antenatal care as well as delivery in a hospital which you are comfortable with, which is accessible to you, and with the doctor that you are comfortable with. It is very important. Attend the antenatal clinic as advised, usually in the first 3 months every month, the second 3 months, which we call as the second trimester, again once every month, and thereafter once every 15 days. The doctor will advise you upon the ultrasound that you have to do. Sonographies are essential to find out how the baby is. At 12 weeks we do it, it's called the first trimester scan, where you're looking at the nose, the neck, the heart, and you're combining it with a test called as the dual marker test for screening of Down syndrome. After the first trimester, the next sonography is at 5 months, which is the targeted anomaly scan. And thereafter your doctor will advise you to do the growth scans. But remember friends, sonography is for knowing how the pregnancy is proceeding, how well the baby is growing. If there's any problem, your doctor will advise you accordingly. It is never to be used for sex detection, and all the gynecologists have sworn that we will save the girl child. Very importantly, remember, safe delivery is very essential. We must reach our destination of safe motherhood. And very importantly, if there's a rise in blood pressure, we have now started a course for our doctors to have a standardized way of management. If there is any rise in blood pressure, the medicines will be advised, and we don't want any young mothers to die because of blood pressure complications and of a very serious condition called eclampsia. Learn to identify the symptoms and deliver always in a hospital which is close to you. Access to the hospital telephone number of your doctor, your ASHA worker should be with you. And friends, I would also like to talk about one very important problem, and that is empowerment of the youth, because the young boys and girls are the future of tomorrow. 2020, India will be the youngest country where 1 in every 3rd is a young person under the age of 25. And therefore, we have a wonderful module called Youth Mela, where we are talking about protection and promotion of reproductive health, prevention of unwanted pregnancy, sexually transmitted infections, abuse for boys and girls, and prevention of cervical cancer. We also talk to you about self-defense and the first aid, and we have done 160 youth melas with my team of Jayam Kannan, Priti Vyas, Sampat Kumari, and so many doctors, and all of them organized a youth rally just 2 days back. 550 young girls and boys walking along with us 6 o'clock in the morning, carrying placards of educate the girl child, save the girl child, health is wealth. And we walked down and we came in for the flag hoisting of the Foxy flag and the Indian flag at the venue of the Chennai Trade Center. And that's where we inaugurated the first session of the day, and that was the flag hoisting. My young friends, education is important. Health is very important. Women should be empowered, should be learning to take decisions on their own. And all the fathers and all the men who are listening to me, respect the woman. Take care of the woman. A woman is your best friend, your mother, your daughter. She could be your wife, your sister, your friend. Respect all of them. And that's how we can go ahead in the society. An empowered woman will lead to an empowered India, and we as Foxians will pledge for excellence. Thank you very much. Jai Hind, Jai Foxy.